Hello and welcome back to Second Opinion. I am really excited today as your host, Dr. Bryan Laskin, where of course we're looking to increase the influence of today's engaged dentists. We have an amazing guest today for our discussion. It's Dr. Mike Miyasaki. He practices in Sacramento, California, and has been seeking a better way of doing dentistry for over 35 years. He's also involved with Vista Apex dental materials as an innovator in restorative and endodontic products. Today, he likes to share his ideas that support his colleagues to have more successful practices. Obviously, something we share. Thank you very much, Dr. Miyasaki, for being on Second Opinion today.
Hey, thank you, Dr. Laskin, for having me on. And I really applaud you and Upgrade Dental for everything you're doing because I think you're absolutely right. We're just trying to share information to make our colleagues' lives easier. And as a wet-fingered practitioner, I don't want to say struggle, but I deal with all these challenges every day. So whatever we can do to share and make all of our lives easier, it's a great opportunity. So thank you very much.
Oh, sure. Yeah, I think it's important. It's great to have, like you said, wet finger dentists who are sharing ideas and innovation with the audience, and just because it's hard to get good information today sometimes, and that's what we're really trying to do is to cut through the garbage and bring sort of the straight information to people. And today I wanted to really focus on product that Vista Apex has that I think deserves maybe more time in the spotlight. The Clean and Boost product from Vista Apex. So could you talk a little bit about what Clean and Boost is and kind of what indications that you see it's good for?
Yeah, I'd love to. As you mentioned, I've been practicing for 35 years, and over 35 years, I've always been trying to figure out how best to clean a tooth to avoid sensitivity and bonding failures. And that's really what Clean and Boost has turned out to be. It's turned out to be a really unique product that I've used for a couple of years now. And yeah, I'd love to share some stories with you and explain to you really how it came to be and how to use it, the indications for use. So Clean and Boost was developed by a company called Apex Dental, headed up by our current Vista Apex CEO, Scott Lamaran, and Dr. John Kanka III, who, as many of you know, he was like an innovator in etching teeth with phosphoric acid. He was one of the first ones that told us that we could actually put phosphoric acid on the dentin and not kill the pulp or the tooth. So he was an innovator. And what they were doing, this was a while back, is they were trying to figure out all the CEREC doctors. And I've been a CEREC doctor now for over a decade. And those of you who have used an intraoral scanner like the CEREC way back in the day, what we had to do is we would prepare a tooth and then we would bring the intraoral scanner in over that tooth. But the tooth was wet and shiny and like a camera taking a picture of a mirror, it was having a hard time capturing that image. So what we would do is we'd take this OptiSpray, an imaging powder, and we'd spray the preparation with that powder, and it would kind of create a matte surface so that we put our scanner over the prep. It could capture all the details and all the accuracy. Well, that was great when we were trying to capture the image, but then trying to get that powder off of the preparation, because remember, it's a really fine powder. It gets into all the nooks and crannies. We have to go back in there and try to scrub all that stuff off before you bonded it on because we wanted a maximum bond. Well, that's when Apex Dental Materials, that was half of what's now Vista Apex Dental Materials, Scott and Dr. Kanka came up with what's called Clean and Boost. So Clean and Boost actually can get in there and clean the preparations of all this imaging spray, this OptiSpray, and it does a really great job. But as we all know, that these intraoral scanners no longer require us to use the spray. So fortunately, Clean and Boost has some other great properties. And I think real quick before we move into those, let me just give you the secret sauce. So Clean and Boost is part nitric acid. So it can get in there and actually clean both enamel and dentin as far as etching. It has isopropyl alcohol, so it's antimicrobial, and it has HEMA, so it can actually occlude the dental tubules and help with sensitivity. So it just turns out they have these three great ingredients that really makes it a very unique product.
Well, that's really neat. Now, first of all, you're making me feel really old because I've been doing CAD CAM for like 18 years and I was pre OptiSpray. I was using the Powder Meister and like we had these other
Yeah.
it's just so yeah that's great. And so yeah, I think it's interesting that kind of like a lot of different materials, it was developed for one application but that had multiple benefits that make it great for other applications today. So could you tell examples of where somebody today would be using Clean and Boost typically?
Yeah, I will say just in my clinical practice, like a class five. If you've ever done a class five and the decay goes up to the gum line or slightly below the gum, and you get in there and you clean out that area of decay and you nick the tissue a little bit. And then if you don't have it isolated with the rubber down, which sometimes is very difficult to do, or it's just not comfortable for the patient, you look at the tissue and you can tell it's a little red up there, but it's not really bleeding. So you take your phosphoric acid and you lay that phosphoric acid up against that gingival, well, the margin up against the gingiva, and you rinse it off. And right away, you start to see all the blood come out because that phosphoric acid has elicited that tissue to bleed. And unless you can get that controlled, you can spend minutes or if not 10 to 20 minutes sometimes trying to control that bleeding. I know myself, I use a hemostatic agent. I'll put some pressure on that area. And, I don't want any of that red to come out while I'm placing my composite restoration or even placing the adhesive. Well, it's interesting because with the Clean and Boost, it has the nitric acid, and the nitric acid will etch the dentin and the enamel as well as phosphoric acid. But the one thing it doesn't do is it doesn't elicit that bleeding. So if I've got that area that's kind of red up there and I'm thinking, oh man, if I put my phosphoric acid up there, I know I'm going to get that red coming out. I'll just take the Clean and Boost and I'll rub it up there for about 30 seconds. And that'll give me a great etch again on the dentin and on the enamel. And then I can go ahead and rinse that off and I don't have any blood to have to deal with. And I put my adhesive and then my restorative materials. So that's just one indication of something that's worked out really, really well for me that actually Dr. Kenka told me about that technique and how to use the material there. And I tried it and I've had some great success using it in that area.
Yeah, it's great. So if you have an area that you're worried about gingival bleeding, Clean and Boost will be able to get you the etchant that you need, but without eliciting any bleeding. That's, I mean, obviously, 'cause once you have bleeding that infiltrates your bond, it's game over, right? I mean,
Yeah, absolutely. And another area is in talking to the KOLs, a lot of our colleagues are using the single bottle adhesive, kind of self-etching adhesive. And why are they doing that? Because they don't have to worry as much about sensitivity. You can't over etch, you can't over dry. You just put it on and it kind of takes care of everything all in one. But as we all know, when you have a single bottle solution, there's a little bit of compromise here and there, like with the acidity that you have in a single bottle adhesive. So again, another great use that we found is that when you prepare a tooth, and I don't know, you don't have these issues, but there's handpiece oil, there's the blood and saliva like we talked about, there's all the tooth dust and everything like that that makes the smear layer. And unless we clean all that off, we know we're going to have a compromised bond. And if we have a compromised bond, we're likely to have sensitivity issues and then maybe even some marginal breakdown at the enamel margin because a lot of these single ball adhesives don't etch the enamel as well. They etch the dentin fine, but not the enamel as well as, let's say, phosphoric acid. So again, another thing that we've learned is that if we use Clean and Boost will clean off all that because it's got the alcohol and in the acidity. So it'll clean all that debris off and all the contamination. But then it'll also etch the enamel much better than a self-etch adhesive. And it will again etch the dentin. And then with the HEMA, it has a desensitizer. So we have seen that if you're using a single ball adhesive, using Clean and Boost to clean that preparation before applying that bottle, you can actually increase your bond strengths by over 36%. Of course, it depends on which kind of adhesive you're using and the results may vary a little bit, but we've seen yeah, staggering results. When somebody says, "Hey, you can increase your bond strength by 30% by just cleaning the preparation with this," that and decrease your chance of sensitivity. I think that's something that you want to look at.
yeah, that's how we use Clean and Boost in my practice too, because I feel like prior to using Clean and Boost, it was more just a single bottle adhesive. And so when we need to get the extra bond strength, or when we want to do, or if you're worried about any contamination, it's great to clean out the prep, enhance your bond strength, but without the potential downsides doing a total etch technique.
Yeah,
I think it feels like there's like 12 different ways to do etching today, but I think
yeah.
Clean and Boost is sort of it's like a no-brainer addition to a universal adhesive like you're talking about. I think it's fantastic.
Yeah, the again, the KOLs when we met up with them, a lot of them said this is like the first major advancement in etching since somebody like Dr. Kanka was talking about putting the phosphoric acid on the dentin and enamel. again, having practiced for decades and not having seen any advancements in a type of etch we use, clean and boost, is a great advancement. So we're pretty excited about that. If I could share, well, there's two more. There's the clean and boost comes in a liquid and a gel. And I don't know about you when you're using Clean Boost, which one you use, but I find I use the gel probably more than liquid. But if you're using like our Pit and Fissure sealant, using the Clean and Boost liquid really gets into all those pits and fissures and cleans them out really well. So when you place your pit and fissure sealant, you're going to get better adhesion there. The other good thing about well, I primarily use a gel, but I've had a few of these patients, and maybe it's post-COVID or whatever, but I get these patients that haven't been in to see the dentist in years, and they come in and the hard part is you'll take an X-ray of that, and the decay is almost touching the nerve. Like you got this paper thin wall between the outside where your prep's going to end and where the pulp is, but it's asymptomatic. And when you go in there and you tell the patients, it's going to cost you maybe a couple $1,000s because I got to do the root canal and they have to do the crown. I mean, just naturally, I think they're kind of concerned about that because who wants to spend a couple $1,000s on something that doesn't hurt? I go in there and I think, well, okay, my second option is I can go in there and try to clean it out. And I tell the patients, I go, you know what? I think the tooth's going to probably need a root canal because we are really close to where the nerve of the tooth is right now with the decay. And when I get in there, we're either going to expose it or we're going to have a paper thin barrier between the two. But the other option is I can try to place restoration, a direct restoration. So we're not going to do the root canal. We're not going to do the crown. We're just going to clean it out. And then we're going to use a bioactive material that will help the tooth heal itself up. And I've had some great success with this where I get in there, I clean everything out. I get all the infected dentin out, most of the affected dentin. So I'm on good, strong dentin that when I scrape it, you can actually see that, it stays put, it's solid. And if there's a small exposure or if I can see that red eye of the pulp in there, what I do is I use Clean and Boost because Clean and Boost, again, it's going to give me the etch of the enamel, but it's going to be much kinder on the dentin. So I feel like I'm being more gentle on the pulp also. And then I leave that there for the 30 seconds. So I get that full etch on the enamel. Then I rinse it out thoroughly. And then what I do is I then put the Regen, I use the Regen Universal Adhesive, which has the BioGlass. So it has the bioactivity in it. And I place that and then a layer of our Regen flowable composite liner that again has the BioGlass in it. I just tell the patients, I go, what I'm doing now is I'm putting the material down in the deep parts of that cavity, really close to where the nerve is. But this material is a different material than the fillings that we've been using in the past. It will actually help the tooth heal itself. And I lay that in there, kind of, I feel like I'm putting that right down up against the pulp, but it's got the bioglass that will again help the tooth heal. And I'm insulating that pulp, and I just fill the whole thing up. And I will tell you, I've been doing a lot of those in the last year, and knock on wood, none of them have blown up. When I see the patient's back, I go, "How's that tooth doing?" This is the tooth that had that really deep cavity in it. How's it doing? So far, the patients haven't complained about them. They're pulp testing healthy, and so I think that's been a really, for me, a practice changer. And I always tell the patients what we're placing on their tooth as we're doing it. We're using this cleaner is going to kill all the bacteria, remove all the oils, remove all the contaminants. And then we're going to put, this adhesive and this flowable composite in there that has this bioglass that actually helps the tooth heal. It doesn't just fill the hole in, it helps the tooth heal. And I know patients come through and they go, you know what? I'll pay more for that. I tell them, I go, you know what? You don't have to pay any more for this. It's just what we normally use, but we're always trying to keep up with the latest and the greatest. So we're using materials now that don't just fill the holes, they actually help the tooth heal from where those holes were. And I think that's really important.
Yeah, I think that's a great point you bring up. And I want to restate kind of what you said because not everybody listening may be familiar with regen or bioactivity and what makes regen kind of different. But the combination of using Clean and Boost, which is again, it has that etchant which is less irritating to the pulpal tissue. So you're being conservative from a pulpitis standpoint with your etchant. Then you're laying down the regen adhesive, which is, as far as I'm aware, the only bioactive adhesive, which
Mhm.
means it has bioglass, which will remineralize tissue. And then the liner, which I've been told that I think it's very interesting, is that the liner acts as like a fuel source for the adhesive as it remineralization happens. The liner then refuels the adhesive so we get more bioactivity to the source. And so you're really, in addition to doing a more gentle etch with Clean and Boost, you're adding a remineralization area both with the regen adhesive and liner that's then going to repair that area. So it's not the same as just bonding over because you're actually are going to generate tissue healing at that spot, correct?
Correct. And I think that's kind of another topic for a second opinion talk. But yeah, the Regen product line is the only product line that has that type of bioactivity. A lot of other products will say, well, we have some kind of exchange of fluoride, calcium, and phosphates to help heal the tooth. But and I encourage, our listeners today to even look at Bioglass. But Bioglass actually causes the body to it activates the healing mechanism to create hydroxyapatite type materials, whether it be on bone or in a tooth. So it really is doing so much more. I call it genetic expression more than just the ionic exchange. And I think that's really what sets it apart. So if we can use something like Clean and Boost that cleans that preparation very, very well, gets all the bacteria out, has a desensitizer in it, etches the enamel and cleans the dentin out, and then we put these materials down against that surface that allow it to heal itself. I think we're really doing the best that we can do today for our patients. And that's the exciting part because those are the fun things to be able to share with this upgrade group and be able to share with clinicians like yourself who are trying to get the word out. And when we did the upgrade presentation, which I thank upgrade for allowing me to do, we went into a lot more detail into how the mechanism works and how we actually apply the materials. But I think this is great. When I look back at 30 years of dentistry, talking about the old CEREC 18, 20 years ago, and all the milestones that we've gone through and intraoral scanning and milling, and now we're talking about kind of simpler things that a lot of us are doing every day. We're doing tens of millions of these restorations every day, and if we can start doing it in a way where we're actually helping the tooth heal itself and helping our patients, I think that's kind of why we all got into dentistry, to do the best for our patients.
Yeah. Well, I mean, if you think about the material side from CAD CAM, back when I started doing CAD CAM, we only had feldspathic and lucite, and now there's like 150 different types of ceramics that are strengthened, but they're really, to your point earlier, there hasn't been any real innovation when it comes to etchant. It's been the same stuff
Yeah.
my entire career. And so maybe the universal adhesives have come a bit of a ways, but getting over 30% increase if you're using a single
Single.
bottle universal adhesive by using Clean and Boost, it's a no-brainer if that's what you're doing. So could you describe what are the steps? Like if a dentist listening today is like, well, it's so easy for me just to use a single bottle adhesive. Why would I want to add it? Like, what are the steps that they're going to need to incorporate into their workflow in addition to just a universal adhesive?
That's a great question, and the nice thing is not a lot to add in. All you're gonna need is some Clean and Boost. It either comes in a syringe. I usually use a syringe and have just a little tip on it with a little brush, and so you just brush it on the preparation for 20 to 30 seconds, and then you rinse it off, and then you go into your single ball adhesive. That's all you really need to do. So there's not much more we have to add. But again, when I'm doing it and I'm thinking about it, I'm thinking, here I am brushing this cleaner to remove all the handpiece oil and all the dust and debris and bacteria and all the blood and saliva. I'm taking that all off my preparation. So when my adhesive hits that surface now, it's going to really, really be able to bond, to its optimum level on that against that surface. And to me, it's just kind of common sense. And I like to think that way, versus we get in there and a lot of us that are doing the single bottle, you're not going to put phosphoric acid etch on there. You're just going to use that adhesive as it is. But if it goes on and you've got that bacteria there, you've got hemp oil there, or anything like that, your bond strength's going to be dropping. And usually with single ball adhesives, the bond strengths are a little bit lower already. It's more of a convenience factor. So all you have to do is just brush that on to the preparation, 20, 30 seconds, rinse it off with water, and then kind of move on. So it doesn't, add a lot more. Even in time, it doesn't. But it will really, talking about the advantage, redo dentistry is always the most expensive. And if I place a class 5 and it pops off, or I place a multi-surface restoration like a class 2, and the patient says, ever since we did that, that tooth has been hurting when I bite, or have something hard or cold, and it doesn't go away, so we end up having to redo that. That's expense. And if I can take 30 seconds and increase my bond strength scores and decrease the chance of sensitivity because we have a desensitizer in there, that to me is invaluable, or an invaluable savings. And so I think it's one of those things that we can all incorporate very, very easily. It's just we need to get the word out.
Oh yeah, agreed. And I mean, the worst day or the worst time is when a patient comes back. They had relatively small restoration, so you didn't talk about the sensitivity because it was in your mind it was a small issue, right? And they
Yeah,
come back and they said it didn't hurt before you did that, and now it does, right? And
yeah.
that's one of the big things you're avoiding with clean and boost is you're cleaning it and you're adding desensitizers, so the likelihood of the tooth being sensitive after the fact is much less.
Yeah, when you get that sensitivity going, it's like, oh, there go your marketing dollars. So, again, making this small change will help you save on the front end and the back end. It'll increase the practice profitability. It'll take your stress level down a little bit. And I don't know, I think about it. I often will relate to patients. I go, before you paint a piece of wood, if it's an old piece of wood that's been sitting out, that's been weathered, you just don't usually put the paint right over the top. What you'll do is you'll condition the wood by sanding it or clean it somehow, preparing it to receive the paint. I think of the paint as kind of like a restorative material, like composite. And what we're going to do is we're going to prepare that tooth surface to receive that restorative material, or our paint, so to speak. And I don't know. I think it just makes sense to our patients, and I think they appreciate that we go that little extra effort of 20 to 30 seconds to make this work better.
Yeah, and I think for the dentist listening, I think it does make, like you said, it just makes empirical sense too. That we when you look at the SEMs of what the smear layer looks like, and that you're just going to be bonding directly to that. Obviously, it's going to be less sensitive and have a much higher bond strength if you clean that off, which is what you're doing, very in a gentle manner. If you're not used to using phosphoric acid today, this is kind of like, I think, a good step where you can get the bond strength without the downsides. And then, like you said before, if you have a deep class 2 or a class 5 where you're worried about incorporating gingival bleeding, or even close to the pulp, or if you're worried about irritating the pulp, it's a no-brainer adjunct to add to your restorations.
No, you have it right on. And one other situation I forgot to bring up is like temporaries. If you're a doc that makes temporaries and you pop that temporary off, a lot of times you have that cement, and sometimes you'll have that little black scuzz line because a little bit of the bacteria got up underneath the margins. And how do you clean that without irritating the tissues? Well, there happens to be this thing called clean and boost. You could get in there and just scrub it, remove all the bacteria, get the surface all clean, remove the temporary cement, so it's all ready then to bond once you're ready. So, yeah, I mean, it's like the Swiss Army knife of materials as far as cleaning and preparing the tooth.
Yeah, I hadn't even thought about that before, but that is a phenomenal indication when you're removing temporaries, because we do a lot of CAD camps, so there's not a ton of temporaries. But if you do have that, that's the worst. That black scuzz after attempts
Yeah,
to
yeah.
clean off, and so yeah, using cleanup that would be perfect for that. It just would clean it up fast. That's great. Well, where can people go to find out more about Clean and Boost?
Go to the Vista Apex dental materials website. It's a good place to go. And I will tell you, I think they should always stay attuned to upgrade. I think there you could probably get some of the information, but yeah, just go to the Vista Apex dental materials website.
Great. Well, as always, Dr. Miyasaki, it's been a pleasure talking with you. Thank you so much for bringing your knowledge to the audience, and appreciate it.
Dr. Laskin and the upgrade team, thank you all very much. We really appreciate it, and think you're doing a great job. So I wish there were more docs like you that could see the greater vision of what's going to be good for dentistry. So thank you very much for everything that you do.
Well, appreciate it.